Welcome back to Time Out with GC right here on channel 263. My following guest is an orthopedic surgeon. He's a specialist, a very good friend of mine and a very good friend of the show. As you remember, the end of February, Tiger Woods was involved in a single car accident that could have ended his life. But how threatening is that accident indeed? We don't know the particulars, whether Tiger Woods will play again or this will end his career. But let's talk about the injury. Dr. Rawoot, thank you so much for joining us on the show. So many details have come up from this accident, and I know you as an orthopedic surgeon, this is your bread and butter, this is what you do. We're talking about open fractures, rod inserted in the tibia, injury to his ankle. But what does this mean?
Okay, thanks for having me again, Gershon. So I've read some of the reports that are on mainstream media, social media. There's not much details, but what they do mention is that he injured his right leg, and specifically they mention his tibia and fibula. So your tibia is your shin bone, and what they describe the injuries as, and I've not seen any x-rays or so, but I'm speculating going on the reports that were made. They mention a compound comminuted tibia fracture. So what that means is compound means an open fracture. So if you sustain a fracture and there's a break in the skin that's associated with the fracture, that's described as a compound fracture.
So that when the bone is showing?
Yeah, it varies. It can be a minor. We grade it in terms of 3 grades. So your grade 1 would be your in and out puncture wound. So it's a tiny little wound, less than 1 centimeter. Your grade 2 would be a laceration or a cut that's between 2 and 5 centimeters. And then your grade 3 are much bigger wounds associated with the fracture. You'll have associated nerve and vascular injuries as well. So again, there's not much details about it, but from what they described, how they treated the fracture, I would suspect it would probably be a grade 1 or a grade 2, most likely a grade 1 injury. Then they talk about a comminuted fracture. So a comminuted fracture is a fragmented fracture. If you were to break a bone and you had 2 pieces of the bone, that's a simple fracture. The moment you have multiple fragments, then we describe it as a comminuted fracture. So again, looking at the reports, they describe his tibia fracture, the shin bone, as being close to the knee joint and then also close to the ankle joint. But again, not much specifics. I haven't seen any x-rays on media. So just going about what they've described. What they've mentioned, and I've brought some...
Now this is the exciting part. I mean, when Dr. Rawoot was explaining this to me, this is the exciting part. You have to see this. There are titanium rods that is being inserted. Now, medically, things have come a very long way from when this was first brought to maybe in the World War. But let's explain exactly what happens with the surgery. Okay,
so Gershon, what I've done is I've brought some model sawbone. This is not the real thing. I've not gone and dug up some skeletons. Also don't have much skeletons in my closet. So this is a sawbone model of the femur, which is your thigh bone, and then this would be your tibia, your shin bone. They mention in the report the fibula as well. So the fibula is the second bone in your lower leg, and that normally runs down the outside or the lateral aspect of your leg. So in terms of function, your tibia carries most of your weight. The fibula is there to support, but it also provides muscle attachment for the muscle groups in your lower leg. So when they describe his tibia fracture, they talk about segmental or comminuted fracture. So I suspect he's fractured it somewhere there and then also close to the ankle. So that's your knee joint there. The kneecap would be sitting somewhere there. And again, not much detail about the ankle. They mentioned he's got some ankle and foot injuries and they put some pins and screws in there. Don't know the details about that. But you mentioned the rod. So what I've also got here.
All right, so if you were the orthopedic surgeon that's been told, hey, you're working on Tiger Woods right now. Okay, we don't have all the details as to how exactly where it's broken, but what would you be doing?
Again, it depends on the injury. So there's no one way to fix all fractures. You have to take into account the configuration of the fracture, where it's located. Is it extending into the joint? Is it involving the shaft? So those are things we need to take into account, because you can fix these fractures with these titanium rods, and these basically go in the canal of the bone. It's what we call intramedullary rods. You can fix it with plates and screws. You have the external skeletons. You may have seen some patients with these bars or circular contraptions around their limbs. Those are what we call external fixators. So those are the surgical ways you can fix it. In the past, if you look at the femur fractures, you may recall if you went to hospitals like Groote Tygerberg, there were these wards where they had these traction devices attached to the beds. So these patients with femur fractures were treated in traction for up to 3 months in hospital. These titanium rods have revolutionized how we treat these patients now, in that it's minimally invasive, small little cuts that we make. It's all done under x-ray guidance. So the recovery is so much quicker, and instead of the patient spending 3 months in hospital, now they're going home 1 or 2 days after their surgery. It all depends on whether they have associated medical problems or associated injuries or complications. Now, one of the potential complications that Tiger Woods may have sustained, they talk about having performed a procedure called a fasciotomy. Now, that's for an emergency procedure for a condition we call compartment syndrome, and I'll go into that a bit later. So, yeah, coming back to his injury, this is the type of rod that you would have had inserted into his shin bone, and we either make a little cut above the kneecap or below the kneecap, and the rod basically goes in here. That's just below your kneecap, and it sits in the canal of the bone. You'll notice that it's got some holes on the top.
Is that for the screws? Yeah.
Yeah. So those are for locking screws. So you'll have 1 or 2 well, I normally put 2 screws in at the top, and that locks the rod inside the bone. So it's not going to be moving up and down. You must understand the whole point of doing the surgery is to get the patient mobile as soon as possible. So when we do the rod fixation, patient can basically start mobilizing the next day. The other advantage is we don't have to put them in a cast afterwards. It's fixed internally. So it's been stabilized internally. No need for a cast. It's so much more convenient. Again, if you look at how it was treated more than 30 years ago, and you still see it in the movies, you see these patients with multiple trauma, they've got casts on every limb type of thing. So if you were to treat a tibia or shin bone fracture conservatively or non-operatively, that patient would have to be in a cast that extends all the way up to the groin. So it makes mobility so much more difficult.
And unhygienic too.
Yeah, definitely plays a part in that it hinders personal hygiene. So these rods, it's minimally invasive, the recovery is so much quicker, and it's so much more convenient for the patient. They spend less time in hospital, and it makes it a lot easier for them at home.
Now, the question that most people want to know too, and we'll get to this also, is that in South Africa, when we treat operations like this, for example, but Tiger Woods, recovery, I mean, he's had back surgeries, multiple back surgeries, come back, won a major, he's been phenomenal. So his fighting spirit is there, he's dominated golf for 25 years. Could this be the end of his career?
Okay, with regards to how we fix these fractures, we're quite fortunate here in South Africa, in Cape Town, at the major teaching hospitals, Groote Tygerberg, we see lots of trauma. So compared to the rest of the world, we're fairly experienced in managing these trauma conditions. Also, we have access to pretty much the same equipment and instrumentation rods that they would use in first world countries. If anyone here was to sustain similar injuries here in Cape Town, before COVID, we could operate on the same day. There were no restrictions nowadays. A lot of the patients have to be tested for COVID first. And this, in this case with Tiger Woods, where he's got the segmental fracture, that you try to operate sooner rather than later because it's an open injury. So already you would have been managed in the emergency department, and there the wounds are cleaned. They get given prophylactic antibiotics, and that significantly reduces the risk of infection, and it's infection of the soft tissues and of the bone. Once you get infection in the bone, it's really difficult to eradicate that infection. Antibiotics alone may not be sufficient, and there's a higher risk of recurrence as well. So How the patient gets treated in the emergency department is very important. So it's that cleaning of the wound, stabilizing of the fracture. So already the paramedics, when they get the patient on the scene, you notice they use those orange splints to splint the leg. That's very important in terms of blood loss, patient comfort. All of those things play a part. Then once the patient's had the x-rays, that's when we make a decision, okay, how are we going to treat this? And as I said at the beginning, there's no one way to treat all these fractures, and sometimes it requires more than one surgical procedure. So if you have extensive soft tissue damage, you may just have to go and debride the wounds. That's where we remove all dead tissue, clean out the wounds thoroughly. Then we might have to use those external fixators that I spoke about to temporarily stabilize the fracture. And then you go back at the second sitting, normally after 48 hours. During that time, the patient would have been getting antibiotics intravenously. It's a complex way how we go about treating these injuries. So coming back to what can we expect of Tiger Woods now? You've mentioned he's had several spinal operations before. He's made a tremendous comeback, having won the Masters. So he's got that drive. He's received the appropriate treatment. He's going to get fantastic rehabilitation. So I wouldn't count him out. But again, I don't know the specifics of this injury. If this was any other ordinary person, what we hope to achieve by fixing these fractures is, one, to get the fracture to heal so that the patient pain can be relieved and their mobility can be restored. In terms of him playing golf, again, I don't know the specifics of his injury. With the appropriate rehab, yes, he can, possibly. But again, I don't know the specifics of his injury. Also, with the rehab that he's getting, it's going to be geared to getting him back to golf. Fortunately, he's not playing soccer, he's not playing rugby, which could potentially have been a career-ending injury. Golfers play till they can play in the senior tour if they need to. So don't count him out that he's not going to be able to play. At that level, we'll have to wait and see. And yeah, and then lastly, I think I mentioned the compartment syndrome. In the reports they mentioned they did a fasciotomy for him. Now that it's another indication of the severity of his injury. When you have a segmental fracture of your shin bone, it's not just the bone that's broken in isolation. There's trauma to the soft tissues as well. So your muscles around the leg, they traumatized as well. Yeah. So what can happen is you can bleed into those muscle groups, and when the pressure builds up, the circulation to that muscle can be compromised. What eventually happens is that muscle dies if it's not treated appropriately, and that's where the fasciotomy comes in. So what they've done is the fasciotomy, and that's where they've released the fibrous layer around each muscle group in the lower leg. By releasing the pressure around within the muscle compartments, they've now been able to maintain the circulation to that muscle group, and that in itself will aid with his recovery. It also is going to prolong his recovery, because once you've done a fasciotomy, again, depending on the extent of the fasciotomy, sometimes we have to make large incisions to do the fasciotomy, in which case you'd have to go back to theatre to have the skin closed and all of that. So that's going to affect his initial rehab. But again, I don't know the specifics about his surgery, except that they mentioned that they've used the titanium rod, that they've gone and done the fasciotomy. So, yeah, he's in good hands. I'm sure he's getting the best possible care. And, yeah, we wish him well with his recovery.
Dr. Abdul Rawoot, orthopedic surgeon, super specialist, and also a very good athlete himself. Probably one of these days we'll see him winning an Ironman somewhere in the world. Thank you so much for joining us on the show.
Thanks, Gershon. I'm just trying.
Just trying. And that is it for this week's show of Time Out with GC right here on Channel 263. It also brings to the end of our season. Thank you so much to everyone for watching our shows week in and week out. I repeat, Saturday mornings at 11 a.m. As always, take care of yourself, take care of your family, keep inspiring, keep educating, and keep motivating. Until next time, God bless, and thank you for watching. Goodbye.